I'm Kelly Kunkel, a plastic surgeon in Fort Worth, Texas. If you want to know how breast lifts are done, this video is for you. Take a look. As plastic surgeons, when we're considering breast lifts, we want to know where the bra line is. In what's considered to be the ideal breasts, the nipples are above the bra line. Also, some women have a lot of tissue that kind of curves down and falls below the bra line, kind of rubs on their chest. We want to correct that too if that's a problem. One way to determine that is the pencil test. If you can put a pencil under the bra line and it stays in place, then you might consider a breast lift just to correct that. There are three main types of breast lifts. I'll start with one called the inverted T pattern or the anchor pattern. When we do that, what we'll do is make an incision around the areola. Then we'll go in and make incisions about like shown here. Take out some of the extra skin and tissue that allows us to move the nipple and areola up, and then we pull all of those incision lines together. And that results in a scar pattern similar to what's seen here. We've moved the nipple up, we've tightened up the lower part of the breast, and you can do that with an implant or without. Here's a photograph of one of my actual patients. Another type of breast lift is called a vertical pattern, or some people think of it as a lollipop pattern. We start out with a similar incision around the nipple of the areola, and then we make incisions about like shown here, so there aren't incisions along the bottom with this pattern. We then take out the extra skin and tissue, move the nipple and areola up, and then pull those incision lines together, resulting in a scar pattern about like this, and you can put an implant in or not. And here's a photograph of one of my actual patients. A third type of breast lift is less common in my practice. This is one for someone who has really not much bottom heaviness and just wants a little movement in their nipple and areola. We start with incision around the areola, and then we make incisions about like shown here. We take out the skin between those two incision lines, and then we move the nipple up a little bit, and we actually pull that outer ring in toward the inner ring, which results in a little bit of movement of the nipple and areola, about like shown here. And here's a photograph of one of my actual patients. That's how we do breast lifts typically. Of course, we'll tailor that procedure to you, the individual person, what you want to achieve. The diagrams and photographs I've used in this video are for educational purposes. They're not the exact incisions that we'll use on each person, and each person will get a different overall result. But I hope that this video has helped you understand more about breast lifts. If you've been thinking about breast lift surgery, we'd love to see you in our Fort Worth office to talk about it. In Fort Worth, keeping it beautiful, I'm Kelly Kunkel.